Now I'm quickly trying to look at the next bone, which we discuss in its anatomy, and this is a bone which is known as the frontal bone. All right, the frontal bone. So you can see a lot of how will I put, labelings, and they are trying to talk about the different parts of the frontal bone, talking about the squamous part, talking about the nasal part, talking about the orbital part, and also trying to highlight the supraorbital foramen. So it forms the forehead and the upper part of the eye sockets. So it extends from the top of the nasal bones to the coronal suture, where it meets the parietal, bones. I'm coming. So shape is a flat bone, is part of the cranial skeleton. So key features, we have the squamous part, just like I was saying, I was trying to identify it. The squamous part, we have the orbital part, which forms like the roof of the orbit. We have the nasal part, which contributes to the nasal, cavity. We have the supraorbital part, have the frontal sinuses. Okay, so that's just it. Okay, this is the frontal bone that we've been talking about. Okay. So articulations, it joins with different bones. That's why it has many parts. It joins to the parietal bones, that's the side of the skull. Joins to the nasal bones. Can you say it? It joins to the zygomatic bones, join with the maxillar bone, join with the sphenoid bone, join with the ethmoid bone. So functions in general is just to protect the frontal lobe of the brain, make sure that nothing gets to it. It is very hard, so if you want to get to the brain, you have to get through it first. It forms part of the orbit and the nasal cavity, houses the frontal sinuses, aids in voice resonance and air filtration. So when you have fractures to it, it could actually be traumatic, and it could lead to issues in the brain. So also we have the frontal sinus infections. Okay, then of course if you want to do any surgeries to the brain, the best part of trying to access the brain is, you could mostly the frontal lobe, you could actually go through this bone.